Hey guys, this is Dr. Adam Avate and Dr. John Kwan. We're with Perfromance Physical Therapy, and today we're going to talk about mobilization and stretching of the piriformis.
Great. So this is a very important part. People with low back problems, people who have like sciatic nerve issues, very common area of tightness that people really suffer from. So I'm going to show you beginners to a more advanced level of stretching and mobilization. So we'll start off with the easiest way. So if you have a table at home, you can get on the ground, whatever's comfortable. Adam's in a supine position. He's going to cross his involved side. And notice how he's anchoring his ankle right on the thigh, and he's going to just gently push down on that knee and hopefully feel a stretch in his hip. This is the easier version, so if you don't feel a stretch, that means that this is not appropriate for you. Then we can progress to what we call the figure 4 stretch. In that same position, he's going to interlock his hands, going to grab the opposite leg. And breathing is very important. You always want to exhale as you go into your stretch. So as he exhales, he pulls that knee to his chest, and you should feel a nice stretch right in that piriformis area. Typical static stretches, you want to hold for 20 to 30 seconds. You can go longer if you want, and vary the repetitions anywhere from 3 to 4 repetitions, whatever you can do at home. All right, great. Now, if that doesn't work for you, or if you feel any pain or discomfort in the knee or in the back, then this is another option for you. You cross that leg, and what Adam is doing is pulling his knee to his opposite shoulder. And in doing so, you shouldn't feel any pinching in the hip. Feel a nice stretch in that piriformis area. Another option for you, piriformis stretches can vary person to person. It's better to have more options, so you can find one that's suitable for you. Great. And then the more aggressive way to do it is in a standing position. So if you have a table at home, or again, you can use a bed or a table. You're going to basically cross that leg, leverage his body weight onto the table, nice upright posture, and he's going to exhale and just breathe and kind of lower his body down. Look at his upper body, nice, tall, erect position. Feeling that stretch, same directions apply. Great. That's one of my favorite ones to do. And then for people who sit behind a desk or working behind a desk a lot, this is another easy way to get a stretch in, or even while you're on an airplane for that matter. Cross that leg, you're going to stabilize the opposite knee, and then again, keeping a nice erect posture, you're going to lean forward until you feel a nice stretch in that piriformis area. Okay, again, you can repeat it on both sides. Great, and then a way to further that mobilization and stretch is using a lacrosse ball. So lacrosse balls are a great tool for self-mobilization. It breaks up that myofascial restrictions, kind of like what a foam roller does. You're going to put it on that hot spot, that area that you feel that tension and tightness. It should be a little bit sore and tender. And two options. He can just roll his hip, internal, external rotation, pivoting his body weight onto that piriformis region. Or he could basically leverage his whole body weight onto that side and mobilize his hip onto the ball. And if you want to up the ante the third time, you can even sit on the ball. There you go. Cross that leg and just kind of roll that body weight right around that piriformis area. Great way to mobilize the piriformis. Very important muscle to keep nice and flexible for those low back patients or those sacroiliac joint patients. Try it at home. You'll feel a nice, good release in your butt.